Quickly to Dr. Catherine, you've been hearing from all the stakeholders, but I want to talk about positive outcomes, especially when it comes to treatment. And there's a wording that we hear, remission and cured. What do those two words mean? Because you'll hear a patient say, I'm in full remission. Many times they feel, oh, I don't need to come back for any more checkups. The draining finances are no longer something I have to deal with. So when you talk about those two words, what does it mean to be fully cured from cancer and to be in remission?
So for cancer, it is a chronic disease. And sometimes you can go into remission, which means you are free of all the symptoms and of the cancer. They've done all the imaging and it cannot be detected. But we encourage patients to go for follow-up. And the survival, the longer the survival is, the higher the chances that you are actually cured of the cancer. So it's always good to be on very close monitoring and go to your doctor, take your medicine as prescribed, so that if you are in remission, we also aim to have a cure for the cancer.
What happens in those cases where the cancer comes back but more aggressively?
So cancer can come back without a warning, and it's important that you see your oncologist to check you and treat it efficiently and in a timely manner. Some patients assume that what they are feeling could be the side effects of the treatment for a long time when actually the cancer is coming back. So always it needs a medical attention. See your doctor to differentiate between side effects and the cancer coming back, so that when it comes back, it can be detected early and can be treated in a timely manner, because when you take long also to get treatment, then it spreads and becomes more aggressive. And cancer is different in every person. There are also different types of cancer. Even breast cancer is not the same between one patient to another. They all have very different behaviors. Some are aggressive, others are not very aggressive.
Daktari Noela, kwako yeye niulize kuhusiana na vipimo vya chembe-chembe. Masaa ile mnafanya pathology kujua kiwango cha kansa kimefikia wapi ama staging. Ni wapi ambapo inakuwa ghali kwa mgonjwa ili aweze kujua ni matibabu gani anayopitia? Pili, je, kuna teknolojia ambazo zinaweza kutumika kwa sasa hivi? Kwa sababu mara nyingi utakuta kuna mgonjwa ambaye ana saratani akienda na katwa sehemu fulani, iwe ni titi, ili kuweza kupimwa. Ikiwa atafanywa tena ukaguzi kuweza kujua stage imefika wapi ya kansa, lazima tena akatwe sehemu nyingine. Huoni kwamba hii pia inaleta unyanyapaa ambao ni stigma na pia